Hey everybody, it's Adam, and I am here at STS in San Diego. I'm very happy to be sitting next to Dr. Sam Bahlky from the Wisconsin Heart Hospital, and we are answering your questions that you posted at the blog. One of the questions was about robotic valve surgery, and we've heard a lot about robotic valve surgery for the mitral valve, for mitral valve repair, and but we've also got some questions about aortic valve surgery using the robot. And luckily, Dr. Bahlky has some incredible experience with that. And so I was hoping, Dr. Bahlky, you might be able to give us an update on the developments in that type of procedure.
Sure. Thanks, Adam. And I wanted to let you know that we actually just had a meeting with some of the interested surgeons on that front. I know you featured in your blog in the past one of the clinical cases that we did, the very few clinical cases that have actually occurred with the aortic valve. Robotic surgery is very successful in mitral valve repair. The aortic valve, on the other hand, presents a different set of problems and issues. And thus far, we're still kind of in the preparatory phase of defining how we can tackle the aortic valve with the robotic technology. And so what has transpired since you and I last talked about this and you presented on your blog is that we're literally waiting for the development of a sutureless aortic valve that can be implanted with robotic technology. And the reason that that is good is that we would be able to basically take away the calcium that encases the aortic valve leaflets prior to implanting this valve, and I think that would be an improvement upon the new percutaneous valves that are in development and are kind of, you know, the rage these days, which it's a very obviously a good technology, but there has been a slightly increased incidence of heart block with an increased pacemaker requirement and probably some leaks around those valves that are implanted through the vein percutaneously. And so I think the robotic technology can really add to that by allowing the calcium around the valve to be taken away and then a nice tight fitting sutureless valve to be implanted. So I think we're probably about a year or so, or a year and a half away from having that type of a valve available in the U.S. We are still working, however, on the approach and port placement and the ability to visualize the valve very well, and we've conducted you know, a lot of good experimentation work and some clinical cases to that end in very selected patients.
Got it. Well, as always, Dr. Bahlky, thanks for the incredible support that you've given all of our community and the education. I just want to thank you on behalf of all the patients out there for the technological advancements that you're trying to pursue to make all of our heart valves even healthier. So thank you very much.
Thank you, Adam. You're doing great work.
Thank you.